muscular. It goes through the muscle to help to support the thread, starts at a deep level and moves to superficial level and exits at point B. From point B to point C is plane 2, which is the most superficial plane and goes through deep dermis and goes straight to the deep dermis as long as you want to point C, which is the point that you identify your vector. At point C, it exits and goes in again, and the same fashion that was at plane 1 is plane 3, which is transmuscular. It starts superficial to avoid the artery and the vein and the nerve, and then goes deep down to point D, where you exit. From point D, from point A, that is the deepest part of the procedure. That's where the needle goes through the periosteum down to the bone and traps right there where the muscle attached to the bone. Exit at point A, and then you have the whole square. Notice the suspension is square and not triangle, as other lifts are, because we believe the triangle doesn't have enough pull. I think you can pull much more tissue, use the square pattern. So once you exit point A and you're in deep space, you tie in a double knot, and you tie and bear the knot under the muscle. Therefore, you don't have extrusion of the stitch. That is it. This is it for the lift. We can obtain a great lift in both sides, and you can see on the video, on a graphical representation of the lift, you can see how much of the tissue can be suspended. Once we finish the lift, that takes about an hour, hour and a half, we move the patient to another room. Then we do a second step. So first we lift, and then we do the tightening. The tightening, we use two procedures. We use radiofrequency procedure and a Tesla procedure. The radiofrequency is important because instead to cut the skin, we believe we can shrink the skin enough. There's no need to resect the skin. So you can use the radiofrequency to treat the skin and therefore get a contraction of the skin. And we'll be able to do like in a jeans effect. You know, you wear jeans 3 or 4 days, it gets loose, you put it in a wash and dryer, it shrinks. The same thing happens with your skin because the cotton is organic fiber as well as collagen. So the heat over the skin produces a shrinkage enough that you might not need to resect the skin at all. And then finally, to improve the contraction a little bit, we use the Tesla effect, which is the machine that removes that thick fluid and edema that is trapped in our tissue. And much like a balloon, if you get a balloon with the water, increase in size and it become heavy, increase the volume. Once we take the water out, now we have a collapsed balloon and shrink. So we believe when you associate Tesla with radiofrequency, you can have a better contour, not only the face but the entire body. We also believe that if you remove that fluid, you can improve perfusion. You deliver more oxygen to the tissue, and that oxygen will allow us to heal the tissue in a much better way. So there's a little detox effect on the Tesla treatment. And of course, once you have the lift and the tightening, the next step will be create some landmarks. It's important to create a new mandible line. It's important to create a new nose, lips. If that construction is done with the volume, we use a procedure called bioplasty, which is the injection of fillers in different areas and in different depth of the face to perform some degree of landmark. So we can create a new maxilla line, you can create an elevated nose, you can create jaw lines, etc. So the bioplasty is very important and it's done there, as you can see in the video, very comfortable for the patient, and we can obtain a much natural and used lips, nasal, labial area, projection of the face, etc. And we also finish the whole process with the Botox. We believe with the Botox alone, you can do a lot for the facial contour. So we control the muscle action, and therefore we can produce a much better effect. And in the end, when the patient leaves, we apply the makeup. We teach the patient, as you see in the video, how to use the skin line, because what I call the Christmas gift effect, you gotta have a wrap. A gift without a wrap, that's not a good gift. So what we recommend is go ahead and restore your skin. And we start the day of the procedure and goes for about 3 to 6 months. And that is the time that we need for the radiofrequency to work anyway. So in the meanwhile, we continue doing Tesla treatments week or every other week. Therefore, in about 3 to 6 months, the patient looks very young, but the results starts at the day 1, which is increase a lot the compliance and the motivation of the patient. And that is it. This is what they call facelift without surgery. Finally, we take the patient for pictures. It's very important to do the post-op pictures so you can compare. And finally, put a makeup. We like to use mineral makeup. And after the makeup, patient drive home. And that's the whole idea. The procedure is non-invasive, it's comfortable, it's safe, and the patient's in and out without interruption of the daily activities. And nevertheless, she's looking young. So that's what facelift without surgery is. And we believe this is the new approach, and it's going to be very welcome because that's what the patients are demanding today. That is Surface. In the name of Surface and my staff, I'd like to thank you for your time and invite you to join us to learn more. How can you look better, feel better with no downtime? I hope to see you soon. For now, ciao.
Sat preacher nailed upon the